Good afternoon, everyone. I welcome you all to the live phone-in program. As you are already aware, today's topic is about the hearing problems in elderly and hearing aid orientation. The callers are encouraged to pose questions in this regard. There are significant number of elderly individuals who have some amount of hearing difficulties, and most often these hearing difficulties are being neglected. Today, we have with us two subject experts themselves to share their experience and provide their valuable insights. Myself, Sahana P, working as assistant professor of audiology, will be moderating the session. We have with us Dr. Sharat Kumar KS, who is an audiologist at the Department of Audiology, who has been working from the past 10 years in the audiology and been involved in the clinical assessment and the management of people with hearing loss. I welcome you to the program. Along with him, we have Mr. Prajesh Thomas, who is an assistant professor of audiology working at the Department of Audiology. Before coming to the institute, Mr. Prajesh has been working in a private clinic where he has gained immense amount of experience fitting the hearing aid to the elderly population. So he knows the best of two worlds. I'm sure he is a perfect person to answer your queries related to the hearing aids. I welcome you to the session, sir. To the attention of all listeners, you can reach us out on 0821 250 2530. And this phone number is also displayed on the screen. As we begin with the session, so this session will also involve some amount of discussion wherein I will pose a different frequently asked questions related to the hearing difficulties in elderly and issues related to hearing aids to our resource persons and to gain their valuable insights. So I request all the viewers to be with us till the end of the session. Yes, proceeding with our discussion. So we often hear that there are a lot of elderly individuals who have got hearing loss. And can you tell us what is the exact facts and figures of the prevalence in our country?
Basically, when it comes to the numbers, as per WHO, they state that about 6.3% of total population has some amount of hearing loss, which includes all age ranges technically, the pediatric, adult and the aged people. However, in 2050, it is expected that one out of four will have some amount of hearing problem. I'm not telling everybody will, 1 out of 4 will start having hearing loss, but some amount of hearing difficulties or ear related problem they will start developing. So it's an alarming thing that they have to take care of their ear and hearing health care. And about 9% of the total population is elderly. So that is our major discussion topic of today. That is, how is elderly people affected with respect to hearing loss. So total out of total population, 9% are geriatric population of above 60 years of age, which will come up to about 104 million people around the world in India. And the prevalence in such people who are aged, if you can divide it into 60 to 70 and 70 and above 80. If you divide, because above 60 it's all geriatric population, that's what we consider it as. So if it is 60 years, it's about 35%. If it is crossing 70 and within 80, it is about 50%. And when it crosses more than 80 to 85, the percentage of people who will develop some amount of hearing loss will reach up to about more than 50%, 50 to 60% of hearing loss, people with hearing loss will be there. So it's a standard thing that whenever age is increasing, there is high chances due to some kind of an aging factor as a major thing. Along with that, there could be some other contributing factors which will lead them to have hearing loss at an older age.
Okay. That is quite a huge number, right? Yes. So during our conversation, sir was also telling about the causes for hearing loss. So along with we, all the listeners would also want to know what are the different causes that can lead to hearing loss in an elderly population.
So, with respect to this topic, I think this is a very valid question, okay, because we in clinics we see that many elderly would come and they would raise a question to us saying that can you tell me what is the reason behind my hearing loss? Because I was not expecting this kind of a hearing loss for me, or they have not found any family tried for that, or no one in their family had a hearing loss, or they have taken care of everything, still they end up having a hearing loss. So that is a very alarming question for them. Okay. So generally, when we look into the causes of hearing loss, the primary factor, the thing that causes the hearing loss in elderly especially, is nothing but aging itself. Okay. So that means as the age increases, there will be some amount of hearing loss. So Dr. Sarath Kumar was talking about the percentage of hearing loss increases as the age increases.
Yes, correct.
So that means our ear has got three parts. One is an external component, there is a middle component, and there is an inner component. So the external component is more about a canal, so that you see the outer opening portion, and the middle part is more about bone, and the inner part is about the sensor which receives the signal and the nerve. Now, as the age progresses, there will be some deterioration in all these structures. So how the signal, the speech when somebody talks to us, so how the signal reaches inside, how the bonds will transfer this information, how the sensor will take this information. So all these aspects will get affected. So there is a normal aging process with which a hearing loss would occur. Okay, and as the age progresses, it varies from individual to individual. There could be some individual who develops a hearing loss into more than 50%. There could be some individual who would only develop in 10 to 20%. Now the other factors which would contribute to this, like why is that somebody would develop more hearing loss compared to somebody else along with aging. Okay, so when we look into those things, some of the factors like noise exposure. Okay, so we can see that if you go outside, okay, in a traffic area, nowadays there are a lot of traffic. Okay, if you go to a normal road itself, you can see if you stay there for 2-3 hours or 4 hours, you see that a lot of noise coming, you get irritated. So that means the lot of noise is occurring. So that noise can create some amount of damage to your ear. So over a period of time, that will accumulate. That could be one of the reasons. Another is other health, lifestyle related diseases that individual would develop. Something like blood pressure or diabetes. So if they are developing blood pressure and diabetes, these lifestyle diseases will have some direct impact on the hearing system. So over a period again, their hearing ability would come down. Another cause would be something like an ototoxicity drugs. Ototoxicity is some drugs that we take, the medicines. When you say drugs, it's medicine. So some of the medicines that we take for long-term diseases, something like kidney diseases, lung diseases, some of the high-dose medicine that are used for cancer treatment, all these medicines again can have a direct impact on our ear and hearing system. So this can also create a hearing loss in individuals. Other than that, very common cause could be ear wax development. So in elderly, like as I said, the ear canal shape will change as they get age. So the skin that is inside the ear canal will get loosened. So normally the canal will be in its perfect size. As the age increases, the size of the canal reduces. So there are some wax getting created inside the ear, which is actually a protective mechanism. But when the ear canal size changes, when it shrinkens, then that wax will get accumulated inside. So if the wax get accumulated, again that will create a hearing loss. Okay. So these can be a major causes of hearing loss.
Yes, as Mr. Prajesh said, there are causes for the age-related hearing loss also. Yes, we cannot manage or we cannot arrest the aging process, but however, we can also avoid other causes such as noise exposure and take medicines with the prescription of the doctor and other things. So with this, we will again move on with our discussion. And most of the audiences would want to know what are the common sciences that can alarm us that I have got a hearing loss?
See, basically, when it comes to cause, anytime you face some kind of hearing related difficulty, either in terms of understanding of speech or you are not able to hear, the similar problem would be experienced by any aged person also.
Right.
But the thing is, after 60 years, they would retire and they are alone at home and nobody is there to interact, or they are not in a position to. I mean, they don't like watching movies or TV. So when the usability of the hearing sense is lesser, they would not report also, because they are not using their hearing senses so much. So they would feel that my hearing is fine. So whoever uses their hearing to communicate with people, to watch a TV or news channel, or discuss with family members, friends, have a chat with friends and family members, so they will start experiencing the difficulties. Such difficulties can be like they will not be able to hear TV noise comfortably. Others might be able to hear it quite good at volume 10 in TV. These people might require like 15 or 16 to comfortably hear. Or they might not respond correctly, or they might not understand speech over phone. Okay, if there is some kind of a noise in and around in home when somebody is discussing with them, they are not able to give proper attention towards the speaker to understand what they are telling. And usually whoever is active in communication, instead of they confirming on the problem, others will clearly notice their problem, that they are struggling with respect to understanding the speech and not able to respond for a sound which is of lower in intensity. So, or if somebody calls from little distance, or somebody is banging the door outside, means in the front door, and a person is in the first floor, probably he will not respond only. Or phone is downstairs and he will not be able to hear. So those are the kind of symptoms the other people would start noticing in them,
Right.
rather than he himself notices. So we have to take what the if because that's the usual trend in aged people, is that if somebody else tells, they think that they don't have any problem. So it is like both the people should analyze whether whatever they are telling, whether this person is exhibiting such symptoms or not. And based on that, they can come to conclusion that he is having difficulty in hearing or not, whether he is able to whether he is having difficulty in understanding speech or not. So depending on that, probably he can avail to services of an hearing professional to get a clarity on their hearing status.
Correct. So, with the discussion, we have understood that hearing loss is not that you are not hearing. Even if you have difficulty in understanding a certain amount of speech, you should always consult a qualified professional and get your hearing tested. So, with this, we'll further move on with our discussion. Yes. So, Mr. Prajesh, can you just explain us what happens if if an elderly person delays the treatment further?
It's a very nice question, because most of the cases what is seen in literature and what we have seen in clinics is that the moment they identify that there is some sort of a difficulty with their hearing, especially in elderly, that they identified that they have got some amount of difficulty. Whether they accept it publicly or not is a different. From that point, taking a decision about a treatment, whether it is a hearing aid or something else, till there it takes around 7 to 10 years. Majorly of it is Western data. So when it comes to our Indian data, it could be more than that. So that
yes.
means around 7 to 10 years, an individual is going to wait and see whether he can manage it without or not, and then they take a decision. So that's where this question becomes a very important thing, right? If you delay it, if you wait for 7 to 10 years, then what happens to your hearing system? Okay, so the primary thing that happens is it hampers your communication ability itself, because
Right.
you are not able to hear. Initially, you are not able to hear only for a few signal, maybe very soft signal, or somebody talking from a distance. Only those things were affected. Now, when it increases, as the age progresses, hearing loss also increases. Then gradually it develops into unable to communicate even in a normal situation. Like when they are among the group, they are going to communicate. In the group, they are not able to communicate. Or even after some time, even with the family, they are not able to communicate. Okay. So as this progresses, so the major fact is with respect to communication itself. The second aspect, the overall well-being of the quality of life gets affected, because now the social aspects will get affected.
Yes,
That means
correct.
they become more of a social isolation.
Right.
Earlier, when you are hearing normally, an elderly after their work, evening they would go out, they would chat with their neighbors, or if there is a shop in the urban area or a village, they would go and sit in that shop and chat.
Right.
So that time they are able to communicate with all the individuals. Now, once they start having a deterioration in the hearing, they gradually isolate themselves.
Yeah, because he is not able to hear clearly, he will avoid such situations,
Because
right?
that result in embarrassment. He goes
Okay.
and sits and communicates. Somebody is saying a joke, he did
Yes.
not get that joke.
Right.
Or somebody
Very
asked
true.
him some question, he did not understand, and so that became a really embarrassing situation. So gradually they move out from all these social situations, so that social isolation. Now the second part added to that will be a depression and anxiety. So they become more of a depressed individuals, because they're not feeling happy about their life, and they're anxious that if somebody comes today to as a guest at their home, they're anxious that whatever they talk to them, whether they will understand, whether they will be able to manage that situation, or if he has to go to a bank or maybe the office, okay, go back to the office and do some work, whether he will be able to manage in those situations, they will become more of a depression and anxiety. So again, their life satisfaction, as I said earlier, the quality of life. Okay, so gradually all these aspects will get affected. So these are the major things that we see as the effect of untreated hearing loss, especially in elder.
Yes. So most often in our clinics, we would see that most of our elderly individuals would avoid wearing hearing aid or would not want to go in for a treatment. Okay. So now you heard what and all domains get affected if you're not getting the treatment on time. Yes. Okay. So with this, we'll move on to the next question. So wherein here we wanted to know more about what are the other treatment options available in case of elderly individuals.
As we already saw, the major cause of hearing loss in elderly is age-related hearing loss, which is
Yes.
more like a permanent and a progressive condition, because age keeps increasing. So the overall body functioning would deteriorate over a period of time. Some people might slowly, for some people it might be slow, some people might be it is faster, depending on the lifestyle or the other healthy related issues. So depending on that, the treatment options keeps varying. And the other things that majorly contribute on what kind of treatment the patient has to undergo is what is the basic other causes that the patient is having to develop such hearing loss. So one is age related, as we saw. The other things are ear infections, frequent ear infections, which could be at the time of that aged period, or it could be a long standing. So like they would have developed some kind of infection at the age of 25 or 30 and they have not treated it correctly, or the reoccurrence of that particular infection might be there. So because of that, there could be a hearing loss.
Yes.
Or there are different degrees and configurations. Some people will have lesser the degree would be lesser extent, and for some people it will be more. And in other conditions, some people will experience hearing loss in certain frequency area, and some other frequencies might be normal. So we call it as configuration of hearing loss. So depending on that, the overall treatment when it comes to it is basically to enhance their hearing capability and to make them independent in terms of hearing and understanding the speech. So for that, the basic treatment option, as we already means, usually the well-versed one everybody usually knows is putting a hearing aid. So obviously the older aged hearing aids were like more like a box kind of a thing with just an thread kind of thing which will go to the ear. So now we have more styles of hearing aids that can be used for patients to make them hear better. For a person who is having 40% also, there are hearing aids which can just supplement his just 40% loss. There are hearing aids or the same hearing aid can be programmed to an extent that if the person is develops to 60%, the same hearing aid can be reprogrammed to match up his 60% hearing loss. So that's the kind of hearing aid technology that we have. So the major part of treatment in aged, if it is only age related the hearing loss, it's basically with hearing aids. But as I told, the second part is due to some infections if they are developing some kind of hearing loss along with aging, then probably a medical attention is also essential. One either with the medication or they can undergo some surgeries to recover from some amount of hearing loss but with the help of the surgery or medication, and then whatever is remaining for that we might treat with hearing aids. Or if the hearing loss is so less that it is just 30%, and with the treatment, medical line of treatment, if it is improving by 20 or 25%, probably we can manage without any kind of hearing aids also. So it is very essential that before deciding that okay, whoever goes to an hearing professional, they will put a hearing aid, so I will not go to them. So first please consult a hearing professional, make sure that what kind of hearing loss the person is having, and then we will, based on his input, you can decide whether hearing aid is necessary or it's a medical line of treatment. In other conditions, as I told, there are different conditions where only configuration of some particular frequencies are affected, or the entire frequency range is totally gone. So in that condition, hearing aid might not also not help them. So in such conditions, we call it as cochlear implant, where surgically one part of device is implanted into the ear, and externally we will stimulate the acoustical signal, where that device internally device will convert it to electrical signal, so which will make them hear better. So this is like the person was okay till about 45-50, and suddenly he developed total loss due to some kind of a medical emergency or road traffic accident, where the entire ear functioning is stopped working and he is having more than severe to profound hearing loss. Then they can go for such devices where it will help them to restore their hearing and understanding ability in a better way. And other thing is, if some people has very limited amount of hearing loss, like about 20% or 30%, their major problem is only in terms of hearing to TV, or hearing to group conversation, or a person who is standing from farther distance, then there are certain assistive devices which can be used for that particular purpose only, for watching TV, or to connect to the phone, or he can use a walkie-talkie kind of a thing to communicate from for the farther distance. So they can use some kind of an assistive devices to overcome only such situation. Other situations he is fine, he will not have experienced so much of hearing difficulty, but in a particular situation he will have more problem where he is more involved into such situation. So then we can offers him such assistive devices instead of totally putting on hearing aid. So only if you consult a hearing professional, then he will be able to decide what kind of treatment or what kind of device he is in need for to overcome his hearing difficulties.
Yes, as Dr. Sharath rightly pointed out, you have to always visit a qualified professional and get your hearing tested. So based on what is the type and the severity of hearing loss, further the management options will be recommended. So with this, we'll move on with our discussion. So most often our patient would ask me, can I purchase the hearing aid online? What do you suggest? What is your view on this?
So, yeah, as the digital era is evolved now,
Yes.
that most of us use online platforms to
Correct.
buy many
Yes.
things, so
Yes, true.
household things, medicines, all those things. So,
Yes, when the medicines can be bought online, why not the hearing aids?
So, uh, if you search online in any online platform, you can see hearing aids available online as well. Now, the question is, you will get hearing aids online. Whether you will be able to use it optimally.
Yes, we have a call. We'll continue our discussion after that. Hello. ಹಲೋ ಹಲೋ ಮೇಡಮ್ ಯಾ ಹೇಳಿ.
ಹಾ, ನಮಸ್ಕಾರ ಮೇಡಮ್.
ನಮಸ್ಕಾರ.
ಹಾ, ನಮ್ ಅಜ್ಜಿಗೆ ಕಿವಿ ಕೇಳ್ಸೋ ತೊಂದ್ರೆ ಇದೆ. ಇವಾಗ ಅವ್ರಿಗೊಂದು 75 ವರ್ಷ ಆಗಿದೆ.
ಓಕೆ.
ನಾವ್ ಇಲ್ಲೇ ENT ಡಾಕ್ಟರ್ಗೆ ಒಂದ್ಸಲ ತೋರ್ಸಿದ್ವಿ. ಅವರು
ಸರಿ.
ಏನು ಮಾಡಕ್ಕಾಗಲ್ಲ, ಮಷಿನ್ ಹಾಕ್ಸ್ಬೇಕು ಒಂದ್ಸಲ ಕಿವಿಗೆ ಅಂತ ಹೇಳಿದ್ರು.
ಓಕೆ.
ಸೊ ಅದು ಕಿವಿಗೆ ಮಿಷಿನ್ ಹಾಕ್ಸ್ಬೇಕಾ ಮೇಡಮ್, ಅಥವಾ ಬೇರೆ ಏನಾದ್ರು ಸೊಲ್ಯೂಷನ್ ಇದೆಯಾ?
ಓಕೆ.
ಈಗ ಮೇಡಮ್ ಅವ್ರಿಗೆ ನೀವು ಹೇಳ್ತಾ ಇರೋ ಪ್ರಕಾರ 75 ವರ್ಷ ಆಗಿದೆ, ಎರಡು ಕಿವಿಲೂ ತೊಂದರೆ ಇದೆ ಅಂತಾರ, ಒಂದ್ ಕಡೆ ಮಾತ್ರ ತೊಂದರೆ ಅಂತಾರ?
ಸರ್, ಎರಡೂ ಕಡೆ ಕಿವಿಯಲ್ಲಿ ತೊಂದ್ರೆ ಇದೆ.
Okay. ಇವಾಗ ಆಲ್ರೆಡಿ ನೀವು ENT ಸರ್ಜನ್ ಆಲ್ರೆಡಿ ಒಂದ್ಸಲ ಕನ್ಸಲ್ಟ್ ಮಾಡಿದ್ದೀರಾ? ಅವರು ಬೇಸಿಕಲಿ ಇನ್ಫೆಕ್ಷನ್ ಇದೆಯೋ ಅಥವಾ ಅದರಿಂದ ಏನಾದರೂ ನಿಮ್ ಕಿವಿ ತೊಂದರೆ ಆಗಿದೆಯಾ ಅನ್ನೋದನ್ನ ಕನ್ಫರ್ಮ್ ಮಾಡ್ಕೊಂಡಿರ್ತಾರೆ. ಯಾವಾಗ ಅವರು ಅದರಿಂದ ಇನ್ಫೆಕ್ಷನ್ ತರದಲ್ಲ ಮಿಷಿನ್ಗೆ ಹೋಗಿ ಅಂತ ಹೇಳ್ತಾರೆ, ಯೂಶಲಿ ಅದು ನರಕ್ಕೆ ಸಂಬಂಧಪಟ್ಟಿದ್ದು ಅಥವಾ ವಯಸ್ಸಿಂದ ಕಿವಿ ಶಕ್ತಿ ಕಡಿಮೆ ಆಗಿರುತ್ತೆ. ಸೊ ಇಂಥ ಕಂಡೀಷನ್ಸ್ ಅಲ್ಲಿ ನಾವು ತಿರ್ಗಾ ವಾಪಸ್ಸು ಕಿವಿ ಶಕ್ತಿನ ಏಜ್ ಓವರ್ಕಮ್ ಮಾಡಿ ನಾರ್ಮಲ್ ಮಾಡಲಿಕ್ಕೆ ಯಾವುದೇ ರೀತಿ ಮೆಡಿಸಿನ್ ಆಗಲಿ ಅಥವಾ ಸರ್ಜಿಕಲ್ ಪ್ರೊಸೀಜರ್ ಆಗಲಿ ಇರೋದಿಲ್ಲ. ಸೊ ಈಗ ನಾವು ಕನ್ನಡಕ ಹೇಗೆ ಕಣ್ಣಿನ ಸಮಸ್ಯೆ ಆದರೆ ಆಪರೇಷನ್ ಮಾಡ್ಬೋದು ಕೆಲವ್ರಿಗೆ ಆಪರೇಷನ್ ಮಾಡಿದ್ರು ಸರಿಯಾಗದೇ ಇರೋರಿಗೆ ಕನ್ನಡಕ ಹಾಕ್ತೀವಿ ಅಥವಾ ಕಾಂಟ್ಯಾಕ್ಟ್ ಲೆನ್ಸ್ ಹಾಕ್ತೀವಿ. ಅದೇ ರೀತಿ ಕಿವಿ ಸಮಸ್ಯೆ ಅವ್ರಿಗೆ ಯಾರಿಗೆ ಟ್ರೀಟ್ಮೆಂಟ್ ಮಾಡಕ್ ಆಗಲ್ಲ, ಪರ್ಮನೆಂಟ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಮಾಡಕ್ ಆಗಲ್ಲ ಅಂಥವ್ರಿಗೇನೆ ಮಿಷಿನ್ ರೆಕಮೆಂಡ್ ಮಾಡೋದು. ಸೊ 75 ವರ್ಷ ಆದ್ಮೇಲೆ ಯೂಶಲಿ ಯಾರು ಸರ್ಜರೀಸ್ನ ಪ್ರಿಫರ್ ಮಾಡಲ್ಲ ಅಥವಾ ಆ ಥರ ಸರ್ಜರೀಸ್ ಮಾಡಿ ಸರಿ ಮಾಡ್ಲಿಕ್ಕೂ ಆಗೋದಿಲ್ಲ. ಸೊ ಹಾಗಾಗಿ ಮೆಡಿಸಿನ್ನು ಸರ್ಜರಿ ವರ್ಕ್ ಆಗ್ತಾ ಇರೋ ಕಾರಣ ಮಿಷಿನ್ ಒಂದೇ ನಿಮಗೆ ಉಳ್ಕೊಳ್ಳೋಂಥ ಆಪ್ಷನ್ನು. ಸೊ ಹಾಗಾಗಿ ಟೆಸ್ಟಿಂಗ್ನ ನೀಟಾಗಿ ಮಾಡಿಸಿ ಅವ್ರಿಗೆ ಎಷ್ಟು ಪರ್ಸೆಂಟೇಜ್ ಕಿವಿ ತೊಂದರೆ ಇದೆ ಅನ್ನೋದನ್ನ ಕರೆಕ್ಟಾಗಿ ಅರ್ಥಕೊಂಡು ಅದಕ್ಕೆ ತಕ್ಕಂತೆ ಸೂಟಬಲ್ ಆಗಿರುವಂಥ ಡಿಜಿಟಲ್ ಮಿಷಿನ್ಗಳನ್ನ ತಗೊಳ್ಳೋದು ತುಂಬ ಸೂಕ್ತ.
ಸರ್, ಎರಡು ಕಿವಿಗೆ ಮಷಿನ್ ಹಾಕಿಸ್ಬೇಕಾಗತ್ತಾ, ಒಂದಕ್ಕೆ ಹಾಕ್ಸಿದ್ರೆ?
ಈಗ ನೀವು ನಿಮ್ಮ ಪ್ರಕಾರ ಅಥವಾ ಪೇಷಂಟ್ ಪ್ರಕಾರ ಎರಡು ಕಡೆ ತೊಂದರೆ ಇದೆ ಅಂತ ಹೇಳ್ತಾ ಇದ್ದೀರಾ. ನೀವು ನಾನೇ ಈಗ್ಲೇನೆ ಟೆಸ್ಟಿಂಗ್ ಮಾಡದೆ ಎರಡು ಕಡೆಗೂ ಹಾಕ್ಸ್ಕೊಳ್ಳಿ ಅಂತ ಹೇಳೋದು ತಪ್ಪಾಗತ್ತೆ, ಅಥವಾ ಒಂದೇ ಕಡೆ ಸಾಕು ಅನ್ನೋದು ತಪ್ಪಾಗತ್ತೆ. ಸೊ ಈಗ ನೀವು ಪರೀಕ್ಷೆ ಮಾಡಿಸಿದ್ಮೇಲೆ ಎರಡೂ ಕಡೆ ಏನಾದರೂ 40%ಗಿಂತ ಜಾಸ್ತಿ ತೊಂದರೆ ಇದೆ, ಮತ್ತೆ ಎರಡು ಕಡೆ ಪರೀಕ್ಷೆ ಮಾಡಿದಾಗ್ಲೂ ಒಂದೇ ತರ ಇದೆ, 40%ಗಿಂತ ಜಾಸ್ತಿ ಇದೆ, ಅಥವಾ ಒಂದ್ ಕಡೆ ಜಾಸ್ತಿ ಒಂದ್ ಕಡೆ ಕಡಿಮೆ, ಬಟ್ ಕಡಿಮೆ ಇರೋ ಕಡೆನೂ 40%ಗಿಂತ ತೊಂದರೆ ಜಾಸ್ತಿ ಇದೆ ಅಂತಂದ್ರೆ ಎರಡೂ ಕಡೆಗೆ ಮಿಷಿನ್ ಹೋಗೋದು ಸೂಕ್ತ. ಒಂದ್ ಕಡೆ 40ಕ್ಕಿಂತ ಕಡಿಮೆ ಇದೆ, ಮ್ಯಾನೇಜ್ ಮಾಡ್ಬೋದು ಮಿಷಿನ್ ಇಲ್ದೆ ಅನ್ನೋದು ಪರೀಕ್ಷೆ ಮಾಡಾದ್ಮೇಲೆ ಗೊತ್ತಾಗಂತ ಒಂದು ವಿಚಾರ. ಸೊ ಅದು ಗೊತ್ತಾದಾದ್ಮೇಲೆ ನಾವು ಡಿಸೈಡ್ ಮಾಡ್ಬೋದು ಮೇಡಮ್.
ಮಿಷಿನ್ ಹಾಕೋದ್ರಿಂದ ಬೇರೆ ತರ ಏನಾದ್ರು ತೊಂದರೆ ಆಗುತ್ತೆ ಸರ್, ಉಪಯೋಗ ಆಗುತ್ತಾ?
ಇದು ಎಲ್ಲ ಮೆಡಿಕಲ್ ಡಿವೈಸ್ ಆದ್ರಿಂದ ಇದೆಲ್ಲ FDA ಅಪ್ರೂವಲ್ ಅಂತ ಇರುತ್ತೆ ಅದಕ್ಕೆ. ಸೊ ಯಾವುದು ನಿಮ್ಗೆ ಕರೆಕ್ಟ್ ಆಗಿ ಹಿಯರಿಂಗ್ ಪ್ರೊಫೆಷನ್ ಹತ್ರನೇ ನೀವು ತಗೊಂಡ್ರೆ ಬೇರೆ ಯಾವ್ದು ಫರ್ದರ್ ಡ್ಯಾಮೇಜ್ ಆಗದಿರೋ ತರ ಏನೇನು ಪ್ರಿಕಾಷನ್ಸ್ ತಗೋಬಹುದು ಅದನ್ನ ತಗೊಂಡು ಮಿಷಿನ್ ಕೊಡೋದ್ರಿಂದ ಯಾವುದೇ ರೀತಿ ತೊಂದರೆ ಆಗೋದಿಲ್ಲ. ಇವಾಗ ನೀವೇ ಹೋಗ್ಬಿಟ್ಟು ಒಂದು ಮೆಡಿಕಲ್ ಶಾಪ್ ಅಲ್ಲಿ ಮಾತ್ರೆ ತಗೊಂಡು ನುಂಗ್ದಾಗ ಹೇಗೆ ಪ್ರಾಬ್ಲಮ್ ಆಗುತ್ತೋ ಹಾಗೆ ನಿಮ್ಮ ಡಿಸಿಷನ್ಗೆ ಬಿಟ್ಬಿಟ್ಟು ಎಲ್ಲೋ ಕಡಿಮೆಗೆ ಸಿಕ್ತು ಅಥವಾ ತುಂಬಾ ನಮ್ಗೆ ಗೊತ್ತಾಗತ್ತೆ ಈ ಮಿಷಿನ್ ತಗೊಂಡ್ಬಿಡೋಣ ಅಂತ ತಗೊಂಡಾಗ ಡ್ಯಾಮೇಜ್ ಆಗೋ ಚಾನ್ಸಸ್ ಜಾಸ್ತಿ ಇರುತ್ತೆ. ಯಾಕಂದ್ರೆ ಪವರ್ ಎಷ್ಟಿರ್ಬೇಕು ಅಂತ ಗೊತ್ತಿಲ್ಲ, ಯಾವ ಡಿಸೈನ್ ಇರಬೇಕು ಅಂತ ಗೊತ್ತಿಲ್ಲ, ಯಾವ ತರ ಮಿಷಿನ್ ಉಪಯೋಗಿಸ್ಬೇಕು ಅಂತ ಗೊತ್ತಿಲ್ಲದೆ ಹಾಗೆ ನೀವೇ ವೆಂಚರ್ ಮಾಡಕ್ ಹೋದ್ರೆ ಆ ತರ ಪ್ರಾಬ್ಲಮ್ಸ್ ಜಾಸ್ತಿ. ಬಟ್ ಕ್ವಾಲಿಫೈಡ್ ಪ್ರೊಫೆಷನಲ್ ಹತ್ರ ನೀವು ಹೋಗೋದಾದ್ರೆ ಆ ಪ್ರಾಬ್ಲಮ್ ಆಲ್ಮೋಸ್ಟ್ ಝೀರೋ ಇರುತ್ತೆ ನಿಮ್ಗೆ. ಬೇರೆ ಏನಾದ್ರೂ ಕ್ವೆಶನ್ಸ್ ಇದೆಯಾ ನಿಮ್ದು?
ಇಲ್ಲ ಸರ್, ಇಷ್ಟೇ ಇತ್ತು. ಥ್ಯಾಂಕ್ ಯು.
ಓಕೆ, ಥ್ಯಾಂಕ್ ಯು. So the previous caller rightly pointed out, is there any need to wear two hearing aids for both the ears?
Basically, as I was explaining her also, obviously God has given us 2 ears. That
Right.
means we have to hear through 2 ears. That is basically because direction of the sound is basically noted based on the information received at each ear.
Right.
So there is a time or a frequency difference that we usually experience when both ears are functioning equally. So the moment we treat one ear with one hearing aid and the other one without any treatment, he will experience hearing sensation correctly in one side and other side will not receive any clear cut information through auditory mode. So because of that, he will start experiencing his dependency will start shifting towards one side, which is
right.
not good for a overall brain functioning and even for his ability to recognize the surrounding environment. It will be more problematic. So it is always preferred unless until there is a medical reason why we should not put a hearing aid, or there is a condition where even with the hearing aid he is not going to benefit in any condition to one of the ear. So my choice is always go for 2 hearing aids.
Okay. And most often I have heard from our patients that if I go for hearing aid in 1 year, how much is the time difference I can purchase a hearing aid to another ear?
Technically speaking, 0. You have to start using hearing aid both of them together. So unless until one side he developed more than 40% and the other side was less than 20%, so there is no condition where the professional would suggest you to go for one hearing aid and not don't go for the hearing aid on the other side. The moment it crosses more than 25 to 30% in better ear also, we can go for hearing aid, because as I told, the power is controllable based on the hearing problem.
Right.
So because it's a programmable digital hearing aids that in the present generation we experience, definitely that will help to enhance his overall hearing experience and surrounding spatial recognition of sound and appreciating the overall sound experience with him.
Right,
so
right.
it's always better to go for hearing aid on both ears simultaneously together. It's not like one month you were hearing the aid for 1 year this month and after 6 months to the other one. It's not advised, because everything, whenever we put a hearing aid, it's not a already experienced part in terms of hearing sensation.
Correct. Yes.
It is totally a different experience. So first time he is experiencing, and the second time when he goes for 2 hearing aids, obviously it's again a difference in perception, overall perception.
Right.
So he has to go the entire learning, the brain has to undergo one more learning process to adjust to the other hearing aid again. So it is always better to go for hearing aid simultaneously, immediately.
Right. Okay. So yes, you heard it right. You have to always wear the hearing aids at the same time for you to better analyze the sounds coming from both ears at the level of the brain. Yes, we have a caller now. Hello.
ಹಲೋ
ಹಲೋ, ನಮಸ್ತೆ ಸರ್, ಹೇಳಿ.
ಸರ್ ನಮಸ್ಕಾರ, ನಮಸ್ತೆ, ಮೋಕ್ಷಿತ್ ಅಂತ.
ಹಾ, ಮೋಕ್ಷಿತ್ ಹೇಳಿ.
ಒಂದು 3-4 ಸತಿ ಕಿವಿ ಸೋರ್ತಾ ಇತ್ತು ಸರ್ ಚಿಕ್ಕ ವಯಸ್ಸಿಂದ.
ಓಕೆ.
ನಾವು ಹಾಸ್ಪಿಟಲ್ ತೋರಿಸ್ತಿದ್ವಿ, ಒಂದು ಟ್ಯಾಬ್ಲೆಟ್ ಮತ್ತೆ ಒಂಥರ ಡ್ರಾಪ್ಸ್ ಕೊಟ್ಟಿದ್ದಾರೆ.
ಹೌದಾ? ಹಾ,
ಈಗ
ಸರಿ.
ಸ್ವಲ್ಪ ಕಿವಿ ಕೇಳೋದು ಸ್ವಲ್ಪ ಕಡಿಮೆ ಆಗಿದೆ. ಮುಂದಕ್ಕೆ ತೊಂದರೆ ಆಗುತ್ತೆ ಮೇಡಮ್ ಅದು?
ಹೌದಾ? ನಿಮ್ಗೆ ಎಷ್ಟು ವಯಸ್ಸು ಸರ್?
28.
ಓಕೆ.
ಮೋಕ್ಷಿತ್ ಅವರೇ, ನಿಮ್ಗೆ 28 ವರ್ಷ ಅಂತೀರಾ. ಕಿವಿ ಸೋರ ತೊಂದ್ರೆ ಎಷ್ಟು ವರ್ಷದಿಂದ ಇದೆ?
3 ವರ್ಷದಿಂದ ಇದೆ ಸರ್.
3 ವರ್ಷದಿಂದ. ಅದಕ್ಕಿಂತ ಮುಂಚೆ ಸಂಪೂರ್ಣವಾಗಿ ನಾರ್ಮಲ್ ಆಗಿದ್ರಾ?
ಹಾ ಸರ್, ನಾರ್ಮಲ್ ಆಗಿದೆ.
ಚಿಕ್ಕ ವಯಸ್ಸಲ್ಲಿ ಏನಿರ್ಲಿಲ್ವಾ?
ಚಿಕ್ಕ ವಯಸ್ಸಲ್ಲಿ ನಾವು 3 ವರ್ಷ ಇದ್ದಾಗ್ಲಿಂದ ನೋವಿತ್ತು.
ನೋವಿತ್ತು. ಓಕೆ. ಸೊ ಅವಾಗ ಕೇಳಿಸೋದು ತೊಂದರೆ ಅನಿಸ್ತಾ ಇರ್ಲಿಲ್ಲ. ಈಗ ರೀಸೆಂಟ್ ಆಗಿ 3 ವರ್ಷದಿಂದ ಕೇಳಿಸೋ ತೊಂದರೆ ಇದೆ.
ಹೌದು ಸರ್.
ಸೊ ಬೇಸಿಕಲಿ ನೀವು ENT ಹತ್ರ ಹೋಗಿದ್ದೀರಾ, ಮೆಡಿಸಿನ್ ತಗೊಂಡಾಗ ನಿಮ್ಗೆ ಇನ್ಫೆಕ್ಷನ್ ಕಡಿಮೆ ಆಗಿರುತ್ತೆ. ಬಟ್ ಕೆಲವೊಂದು ಇನ್ಫೆಕ್ಷನ್ ಕಂಡೀಷನ್ ಏನಾಗುತ್ತೆ ಅಂದ್ರೆ ನಿಮ್ಗೆ ಪರ್ಮನೆಂಟ್ ಡ್ಯಾಮೇಜ್ ಒಂದಷ್ಟು ಕಾಸ್ ಮಾಡ್ಬಿಟ್ಟಿರುತ್ತೆ. ಅಂದ್ರೆ 3 ವರ್ಷ ಅಥವಾ ಚಿಕ್ಕ ವಯಸ್ಸಿಂದನೂ ನಿಮ್ಗೆ ಕಿವಿ ತೊಂದರೆ ಇರೋದ್ರಿಂದ ಒಂದಷ್ಟು ಪ್ರಮಾಣ ಪರ್ಮನೆಂಟ್ ಆಗಿ ಲಾಸ್ ಮಾಡ್ಬಿಟ್ಟಿರುತ್ತೆ. ಅಂತ ಕಂಡೀಷನ್ ನ ಯೂಶಲಿ ಸರ್ಜಿಕಲಿ ಕೆಲವು ಸಲ ಕರೆಕ್ಟ್ ಮಾಡಬಹುದು. ಸೊ ಈ ENT ಅವ್ರ ಹತ್ರ ಹೋಗಿ ಒಂದ್ಸಲ ನೀವು ಆಲ್ರೆಡಿ ಚೆಕ್ ಮಾಡಿ ಅವರು ಸರ್ಜರಿಗೆ ಇಲ್ಲ ಆಗೋದಿಲ್ಲ ಅಂತ ಹೇಳಿದ್ರೆ, ಒಬ್ಬ ಆಡಿಯೋಲಜಿಸ್ಟ್ ಹತ್ರ ಬಂದು ನೀವು ಪರಿಪೂರ್ಣವಾಗಿ ನಿಮ್ಮ ಕಿವಿ ಶ್ರವಣ ಶಕ್ತಿ ಎಷ್ಟಿದೆ ಅಂತ ಪರೀಕ್ಷೆ ಮಾಡಿಸ್ಕೊಂಡ್ರೆ ಒಂದು ಫಸ್ಟ್ ಡೌಟ್, ನಿಮ್ ಕಿವಿ ತೊಂದರೆ ಇದೆಯಾ, ಎಷ್ಟು ಪ್ರಮಾಣದಲ್ಲಿದೆ ಅನ್ನೋದು ಕ್ಲಿಯರ್ ಆಗುತ್ತೆ. ಸೆಕೆಂಡ್, ನಿಮ್ಗಿರೋ ತೊಂದರೆಗೆ ಸರ್ಜಿಕಲ್ ಆಗಲ್ಲ ಅಂತ ಹೇಳಿದ್ರೆ ಮಿಷಿನ್ ಹಾಕೋಬೇಕಾ ಅನ್ನೋದು ಇನ್ನೊಂದು ಕ್ಲಾರಿಫಿಕೇಶನ್ ಆಗುತ್ತೆ. ಸೊ ನೀವ್ 2ನೇ ಪ್ರಶ್ನೆ ಕೇಳಿದ್ದು ಮುಂದಕ್ಕೆ ಏನಾದ್ರು ತೊಂದರೆ ಆಗತ್ತೆ ಅಂತ. ಸೊ ಬೇಸಿಕಲಿ ಈಗ ನೀವೇನು ಆಲ್ರೆಡಿ ಎಕ್ಸ್ಪೀರಿಯನ್ಸ್ ಮಾಡ್ತಾ ಇದ್ದೀರಾ ಕೇಳ್ಸೋ ತೊಂದರೆ, ಅದೇ ತೊಂದರೆ. ಸೊ ಮುಂದಕ್ಕೆ ಅಂತ ಎಕ್ಸ್ಪೆಕ್ಟ್ ಮಾಡೋದ್ಕಿಂತ ಈಗಿರೋ ತೊಂದರೆಗೆ ನೀವು ಬೇಸಿಕಲಿ ಟ್ರೀಟ್ಮೆಂಟ್ ತಗೊಂಡ್ರೆ ಮುಂದೆ ಅಡಿಷನಲ್ ಆಗೋ ತೊಂದರೆನ ನೀವು ಅವಾಯ್ಡ್ ಮಾಡ್ಕೊಳ್ಳೋದಕ್ಕೆ ಸಹಾಯ ಆಗುತ್ತೆ. ಒಂದು, ಪದೇ ಪದೇ ಇನ್ಫೆಕ್ಷನ್ ಆಗೋದನ್ನ ತಡಿಬೇಕು. ಸೊ ಅದರಿಂದ ನಿಮ್ಮ ಫರ್ದರ್ ತೊಂದರೆ ಜಾಸ್ತಿ ಆಗೋದು ತಡಿಬಹುದು. ಮತ್ತೆ ಕೇಳಿಸ್ದೇ ಇರೋ ತೊಂದರೆ, ನಿಮ್ಗೆ ತುಂಬಾ ದಿನ ಅದನ್ನ ಕೇಳಿಸ್ಕೊಳ್ದೆ ನಿಮ್ಗೆ ನರಗಳೆಲ್ಲ ಸ್ವಲ್ಪ ವೀಕ್ ಆಗೋ ಸಮಸ್ಯೆಗಳು ಸ್ಟಾರ್ಟ್ ಆಗುತ್ತೆ. ಸೊ ಅದರಿಂದ ಹೊರಗೆ ಬರ್ಬೇಕು ಅಂದ್ರೆ ಚೆನ್ನಾಗಿ ಕೇಳಿಸೋ ತರ ಮಾಡ್ಕೊಳ್ಳೋದು ನೀವು ಮಿಷಿನ್ ಇಂದ ಸಾಧ್ಯ ಆಗುತ್ತೆ. ಸೊ ಹಾಗಾಗಿ ನೀವು ಒಂದು ಫಸ್ಟ್ ಟೆಸ್ಟ್ ಕರೆಕ್ಟ್ ಡೀಟೇಲ್ ಟೆಸ್ಟ್ ಮಾಡಿಸ್ಕೊಳ್ಳಿ. ಅದಾದ್ಮೇಲೆ ನಿಮ್ಗೆ ಇರೋ ತೊಂದರೆ ಯಾವ ತರ ಅನ್ನೋದನ್ನ ಕನ್ಫರ್ಮ್ ಮಾಡಿಕೊಂಡು ಅದಕ್ಕೆ ಮೆಡಿಕಲ್ ಲೈನ್ ಆಫ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಮತ್ತೆ ಮಿಷಿನ್ ಯಾವುದು ಬೆಸ್ಟ್ ಸೂಟಬಲ್ ಆಗುತ್ತೆ ನಿಮ್ ಪರೀಕ್ಷೆ ಆದ್ಮೇಲೆ ಅದನ್ನ ಸಜೆಸ್ಟ್ ಮಾಡಿದ ಪ್ರಕಾರ ತಗೊಳ್ಳಿ. ಅವಾಗ ನಿಮ್ಗೆ ಫರ್ದರ್ ತೊಂದರೆನ ಸ್ವಲ್ಪ ಮಟ್ಟಿಗೆ ತಡೆಗಟ್ಟೋದಕ್ಕೆ ಅನುಕೂಲ ಆಗುತ್ತೆ.
ಓಕೆ ಸರ್, ಓಕೆ ಸರ್, ಓಕೆ ಸರ್, ಥ್ಯಾಂಕ್ ಯು ಸರ್.
ಧನ್ಯವಾದಗಳು ಮೋಕ್ಷಿತ್.
ಥ್ಯಾಂಕ್ ಯು ಸರ್.
So there was an interruption in our discussion. Yeah, we'll come back to our question. So can we purchase the hearing aid online?
Yeah. So that is a very relevant question. So we are discussing about that online.
Yes, correct.
So part of it, Dr. Sarath was explaining while talking to them.
Yes.
It's like if you buy it online, for the hearing aid to be programmed, okay, you need to go to an audiologist or a hearing health professional. Okay.
Right.
So a hearing aid just cannot be fitted to any individual. Any hearing aid cannot be fitted to any individual with any kind of a hearing loss. So you need to undergo for a hearing evaluation completely and then decide upon which style of a hearing aid would be appropriate, what power of a hearing aid would be appropriate, and any molding, any customization requirement is required for those person, and how that hearing aid has to be programmed for that particular. So everything is tailor made there. Okay. So only with the help of a hearing health professional, you will be able to use a hearing aid optimally. So when you buy it online or just purchase it outside without having any consultation with a hearing health professional, you may not be able to use it wisely, first thing. Second, later on it might damage your existing hearing itself. Because if you are bought a hearing aid which is of higher in power than what is required for you, then as I said earlier, one of the cause for hearing loss is noise induced hearing loss.
Right.
So the hearing aid itself will act as a noise inducer. So it is giving the signals at a very
Excess of noise.
excess of sound.
Yes.
So that itself can damage your hearing system. So
Okay.
it is always advisable to consult a hearing healthcare professional, and then under their recommendation, under their prescription, you undergo for a hearing aid evaluation and fitting.
Okay. So as Mr. Prajesh was saying, so he said something about hearing aid which can be programmed and not programmed. Can you tell us more about this technology?
See, basically when it is programmable or not programmable hearing aid, non-programmable hearing aids are older technology hearing aids where we would control the volume by volume controller. So
Okay.
it will have that hearing aid would have some amount of power where we can control how we control the fan speed. We
Right.
can control the amplifier, how much it should amplify or how much it should not amplify. Based on that, we can control the volume. But problem is when somebody has to hear it very clearly, we have to amplify what is required and accurately amplify only those frequencies which are required. As I told, there are different configuration of hearing loss.
Correct.
Some frequency might be more involved in hearing loss and other frequency might be normal, or entire frequency range might be damaged. So depending on that, we should be able to adjust each frequency sufficiently. It should neither be more than what is required or neither be lesser than what is required. So that is the point where the programmable hearing aids comes into play. So which was last means probably if you go back 30 years back, there were no programmable hearing aids only. So
Right.
only after 95 or 96 we have programmable hearing aids. Previous generation programmable hearing aids we would hardly have one or two channels to
Right.
program. Nowadays hearing aid we have more number of channels where the clarity and the tailor-made amplification can be accurately done based on the hearing loss.
Okay.
Especially in elderly, we usually see sloping configuration. That means high frequency sounds are more affect, frequency hearing loss is more, and low frequency side hearing loss will be lesser. In such people, we usually experience failure of hearing aid fitting only because of this condition. They go to some kind of an cellar where they don't have sufficient sophisticated equipments to adjust such things. So
Right.
they will just amplify everything and give. They will start experiencing too loud sounds, or the clarity is not good and they are not able to adjust to the amplification. Those, because of such complaints, they will stop using hearing aid and they will directly take off the option of hearing aid only. So if you consult a qualified professional who can handle this multi-channel digital hearing aids,
Correct.
in such hearing aid selection and appropriate power selection, obviously they can give, of course I am not telling 100% of the times people will be satisfied, but at least they will not experience more difficulty in hearing. Definitely their problem would reduce, but it might not reach 100% in all the time. But majority of the times, for the people who have good nervous system, like understanding ability is good, it is only problem in hearing. Probably in such patients, we can expect 100% improvement with such programmable hearing aids. So it is basically whether you can access the hearing aid what do you call, the power adjustment through computer and adjust specific to as Prajesh was telling, tailor made to the hearing loss and the degree of loss. It will be easy for us to
Right. Okay. Hello. ಹಲೋ, ನಮಸ್ತೆ.
ನಮಸ್ತೆ.
ಹೇಳಿ ಮೇಡಮ್.
ಮ್ಯಾಮ್, ನಮ್ಮ ಅಜ್ಜಿ ಇದ್ದಾರೆ.
Okay.
ಅವ್ರು ಇವಾಗ 73 ಇಯರ್ಸ್ ಆಗಿದೆ.
ಓಕೆ.
ಸೊ 5 ಇಯರ್ಸ್ ಇಂದ ಅವರು ಕೇಳಿಸ್ಕೊಳ್ಳೋದು ನಿಧಾನ ಆಗ್ತಾ ಇದೆ, ಅಂದ್ರೆ ಕಡಿಮೆ ಆಗ್ತಾ ಬರ್ತಾ ಇದೆ ಅಂತ ಹೇಳ್ತಾ ಇದ್ರು.
ಓಕೆ.
ಸೊ ಅದಕ್ಕೆ ನಾವು ಆನ್ಲೈನ್ ಅಲ್ಲಿ ಸ್ವಲ್ಪ ಸರ್ಚ್ ಮಾಡಿ ಆನ್ಲೈನ್ ಇಂದ ಹಿಯರಿಂಗ್ ಏಡ್ ತಗೊಂಡಿದ್ವಿ, ಅಂದ್ರೆ ಮೆಷಿನ್ ತಗೊಂಡಿದ್ವಿ.
ಓಕೆ.
ಬಟ್ ಇವಾಗ ಏನಾಗ್ತಿದೆ ಅಂತಂದ್ರೆ ಅಷ್ಟು ಕ್ಲಿಯರ್ ಆಗಿ ಕೇಳಿಸ್ತಾ ಇಲ್ಲ, ಆಮೇಲೆ ಶಬ್ದ ಬರ್ತಾ ಇದೆ ಅಂತ ಹೇಳ್ತಾ ಇದ್ದಾರೆ. ಸೊ ನೆಕ್ಸ್ಟ್ ನಾವ್ ಏನ್ ಮಾಡ್ಬೇಕು ಅಂತ ಗೊತ್ತಾಗ್ತಾ ಇಲ್ಲ. ಸೊ ಏನ್ ಮಾಡ್ಬೇಕು?
ನೀವು ಯಾವ ಬೇಸಿಸ್ ಮೇಲೆ ಆನ್ಲೈನಲ್ಲಿ ಪರ್ಚೇಸ್ ಮಾಡಿದ್ರಿ?
ನಮ್ ರಿಲೇಟಿವ್ಸ್ ಯಾರೋ ಹೇಳಿದ್ರು,
ಓಕೆ.
ಸೊ ಅದಕ್ಕೆ ಆನ್ಲೈನ್ ಅಲ್ಲಿ ಪರ್ಚೇಸ್ ಮಾಡಿದೆ.
ಸೊ ಬೇಸಿಕಲಿ ಈಗ 75 ವರ್ಷ ಅಂತ ಹೇಳ್ತೀರಾ, ಯಾವ ಡಿಸೈನ್ ಹಿಯರಿಂಗ್ ಏಡ್ ನ ನೀವು ತಗೊಂಡಿದ್ರಿ ಮೇಡಮ್?
ಸಾರಿ ಸರ್?
ಯಾವ ಡಿಸೈನ್, ಯಾವ ತರ ಇದೆ ಹಿಯರಿಂಗ್ ಏಡ್ ನೋಡ್ಲಿಕ್ಕೆ? ಕಿವಿ ಹಿಂಭಾಗದಲ್ಲಿ ಇಡೋದ, ಕಿವಿ ಒಳಗಡೆ ಇಡೋದ?
ಕಿವಿ ಹಿಂಭಾಗ ಇಡೋದು.
ಕಿವಿ ಹಿಂಭಾಗದಲ್ಲಿ ಇಡೋದನ್ನ ತಗೊಂಡಿದ್ದೀರಾ? ಬೇಸಿಕಲಿ ಕಿವಿ ಹಿಂಭಾಗದಲ್ಲಿ ಇಡೋ ಮಿಷಿನ್ ನಲ್ಲಿ ಪವರ್ ಅಂತ ಬಂದ್ರೆ ಟೆಕ್ನಿಕಲಿ ಆ ಮಿಷಿನ್ಗಳನ್ನ 20% ಇಂದ ಹಿಡಿದು 95% ವರೆಗೂ ನಾವು ಅಡ್ಜಸ್ಟ್ ಮಾಡೋ ಕೆಪಾಸಿಟಿ ಇರುತ್ತೆ. ಅದ್ರ ಬೇಸಿಸ್ ಮೇಲೆ, ಅಂದ್ರೆ ಅದರದ್ದು ಪವರ್ ಎಷ್ಟಿದೆ ಮತ್ತೆ ಅದು ಎಷ್ಟರವರೆಗೂ ರೀಚ್ ಆಗುತ್ತೆ ಮತ್ತೆ ಅದ್ರ ಮ್ಯಾಕ್ಸಿಮಮ್ ಪವರ್ ಏನು ಅನ್ನೋದ್ರ ಮೇಲೆ ನಾವು ಅದನ್ನ ಯಾವ ಲಾಸ್ಗೆ, ಎಷ್ಟು ಡಿಗ್ರಿ ಆಫ್ ಲಾಸ್ಗೆ ಫಿಟ್ ಮಾಡ್ಬೋದು ಅಂತ ಗೊತ್ತಿರುತ್ತೆ. ನೀವು ಯಾರ್ದೋ ಬೇರೆಯವ್ರ ರೆಕಮೆಂಡೇಶನ್ ಇಂದ ತಗೊಂಡಿದ್ದೀರಾ ಅಂತ ಹೇಳ್ತಾ ಇದ್ದೀರಾ, ಪ್ರಾಬ್ಲಿ ಅವ್ರಿಗೆ ಯೂಸ್ ಆಗಿರ್ಬೋದು. ಯಾಕಂದ್ರೆ ಅವ್ರದೇ ಮಾಡ್ಲು ನೋಡ್ಕೊಂಡು ಅದು ಆನ್ಲೈನ್ ಅಲ್ಲಿ ಸಿಗ್ತಾ ಇದೆ ಅಂತ ನೀವೇನಾದ್ರು ಪರ್ಚೇಸ್ ಮಾಡಿದ್ರೆ, ಅವ್ರ ಕಿವಿ ತೊಂದ್ರೆನು ನಿಮ್ಮ ಅಜ್ಜಿ ಕಿವಿ ತೊಂದ್ರೆನು ಒಂದೇ ತರ ಇರಬೇಕು ಅನ್ನೋದು ಏನು ಆತರ ಏನು ಕಂಡೀಷನ್ ಇಲ್ಲ. ಸೊ ಹಾಗಾಗಿ ಅವ್ರ ತೊಂದರೆ ಏನಾದ್ರೂ ಒಂದು 70%ಗಿಂತ ಮೇಲಿದ್ದು ಮತ್ತೆ ಎಲ್ಲಾ ಫ್ರೀಕ್ವೆನ್ಸಿಲೂ ಈಕ್ವಲ್ ಆಗಿ ಅಫೆಕ್ಟ್ ಆಗಿದ್ರೆ ಅವ್ರು ಇವಾಗ ನೀವು ಆನ್ಲೈನ್ ಅಲ್ಲಿ ತಗೊಂಡಿರೋ ಹಿಯರಿಂಗ್ ಏಡ್ ಅವ್ರಿಗೆ ಚೆನ್ನಾಗಿ ಸೂಟ್ ಆಗ್ತಾ ಇರಬಹುದು. ಬಟ್ ಅಜ್ಜಿ ತೊಂದರೆ ಏನಾದ್ರೂ ಒಂದು 35-40% ಮಾತ್ರ ಇದ್ದು ಅಷ್ಟೇ ಪವರ್ದನ್ನ ಅವ್ರಿಗೆ ಹಾಕಿದ್ರೆ ಆಬ್ವಿಯಸ್ಲಿ ಅವ್ರಿಗೆ ತುಂಬಾ ಅತಿಯಾಗಿ ಸೌಂಡ್ ಹೋಗ್ತಾ ಇರುತ್ತೆ. ಮತ್ತೆ ನೀವು ಅಪ್ರಾಪ್ರಿಯೇಟ್ ಆಗಿ ಅದರದ್ದು ಮೋಲ್ಡ್, ಅಂದ್ರೆ ಅವ್ರ ಕಿವಿ ಅಚ್ಚಿನ ಅಳತೆ ತೆಗೆದು ಅವ್ರಿಗೆ ಕರೆಕ್ಟ್ ಆಗಿ ಫಿಟ್ಟಿಂಗ್ ಮಾಡ್ಲಿಲ್ಲ ಅಂತಂದ್ರೆ ಕಿವಿಯಿಂದ ಶಬ್ದ ಲೀಕ್ ಆಗಿ ತುಂಬಾ ಒಂಥರ ಶಬ್ದ ಬರಕ್ ಸ್ಟಾರ್ಟ್ ಆಗೋದು, ಆ ತರ ತೊಂದರೆ ಕಾಣಿಸ್ಕೊಳ್ಳುತ್ತೆ. ನಿಮ್ಗೇನೆ ಈಗ ತುಂಬಾ ಓವರ್ ಆಗಿ ಸ್ಪೀಕರ್ ಅಲ್ಲಿ ಎಲ್ಲಾದ್ರೂ ಒಂದು ಆಡಿಟೋರಿಯಂ ಅಲ್ಲಿ ಎಕ್ಸ್ಪೋಜರ್ ಆದಾಗ ನೀವು ಅದನ್ನ ಎಕ್ಸ್ಪೀರಿಯನ್ಸ್ ಮಾಡಿರ್ತೀರಾ. ಅಂದ್ರೆ ಅಗತ್ಯಕ್ಕಿಂತ ಹೆಚ್ಚಾದ ಸೌಂಡ್ ಬಂದ್ರೆ ಅವ್ರು ಏನ್ ಮಾತಾಡ್ತಾ ಇದಾರೆ ಅಂತಾನೆ ಅರ್ಥ ಆಗ್ತಿರಲ್ಲ. ಸೊ ಅದೇ ತರ ಸಿಚುವೇಶನ್ ಅಜ್ಜಿನೂ ಪಾಪ ಫೇಸ್ ಮಾಡ್ತಿರ್ತಾರೆ. ಸೊ ಹಾಗಾಗಿ ನಿಯರ್ ಬೈ ಎಲ್ಲಿ ನೀವು ಆಕ್ಸೆಸ್ ಮಾಡಬಹುದು ಹಿಯರಿಂಗ್ ಕೇರ್ ಪ್ರೊಫೆಷನ್, ಅಥವಾ ನೀವು ಮೈಸೂರವರೇ ಆದ್ರೆ ಮೈಸೂರಿಗೆ ನಮ್ಮ ಸಂಸ್ಥೆಗೆ ಬಂದು ಒಂದ್ಸಲ ಡೀಟೇಲ್ ಆಗಿ ಅಜ್ಜಿ ಎಷ್ಟು ತೊಂದರೆ ಇದೆ ಅನ್ನೋದನ್ನ ಇದ್ ಮಾಡಿ ನೀವು ತಗೊಂಡಿರೋ ಹಿಯರಿಂಗ್ ಏಡ್ ತಗೊಂಡ್ ಬನ್ನಿ. ಯಾಕಂದ್ರೆ ಸುಮಾರು ಡೂಪ್ಲಿಕೇಟ್ ಹಿಯರಿಂಗ್ ಏಡ್ಗಳು ಆನ್ಲೈನ್ ಅಲ್ಲಿ ಇರುತ್ತೆ, ಪ್ರೋಗ್ರಾಮಬಲ್ ಅಲ್ಲದೆ ಇರೋ ತರದ್ದು ಹಿಯರಿಂಗ್ ಏಡ್ಸ್ ಸಿಗ್ತಾ ಇರುತ್ತೆ, ಅಥವಾ ಡ್ಯಾಮೇಜ್ ಪೀಸಸ್ ಬರ್ತಾ ಇರುತ್ತೆ. ಏನ್ ಪ್ರಾಬ್ಲಮ್ ಇದೆ ಮಿಷಿನ್ ಅಲ್ಲಿ ಅನ್ನೋದನ್ನ ತಿಳ್ಕೊಳ್ಳೋದು ತುಂಬಾ ಇಂಪಾರ್ಟೆಂಟ್. ಸೊ ಹಾಗಾಗಿ ಅದನ್ನ ತಿಳ್ಕೊಂಡು ಅದೇ ಮಿಷಿನ್ ನ ಅಜ್ಜಿಗೆ ನಾವು ಪವರ್ ಕಂಟ್ರೋಲ್ ಮಾಡ್ಬೋದು ಅನ್ನೋದಾದ್ರೆ ಅದರಲ್ಲೇ ಪ್ರೋಗ್ರಾಮ್ ಮಾಡಿ ಫಿಟ್ ಮಾಡಕ್ಕೆ ಪ್ರಯತ್ನ ಪಡ್ಬೋದು. ಇಲ್ಲ ಅದು ತಪ್ಪಾದಂತ ಡಿಸಿಷನ್ ಆ ಮಿಷಿನ್ ತಗೊಂಡಿರೋದು ಅನ್ನೋದಾದ್ರೆ ಅವ್ರಿಗೆ ಯಾವ್ದು ಸೂಕ್ತವಾಗಿರುತ್ತೆ ಆ ಮಿಷಿನ್ ನ ರೆಕಮೆಂಡ್ ಮಾಡ್ತೀವಿ, ಅದನ್ನ ನೀವು ತಗೊಂಡು ಅವ್ರಿಗೆ ಚೆನ್ನಾಗಿ ಕೇಳಿಸೋ ತರ ಮಾಡೋದಕ್ಕೆ ಸಹಾಯ ಆಗುತ್ತೆ.
ಓಕೆ ಸರ್, ಥ್ಯಾಂಕ್ ಯು.
Thank you. So by this we understand that no size is going to fit all. Okay, so you have to get your own hearing tested, and depending upon the type and the severity, the extent of hearing loss, you have to get your hearing aids. Yes. Okay, so we were discussing about programmable and non-programmable hearing aids and other things. Okay, and in the recent caller we have also found that found that the hearing aids can be worn behind the ear, inside the ear. Can you let us know more about this?
So that is something like style of a hearing aid. Okay. So
Okay.
generally we'll have a long conversation with the elderly patients, especially in clinics, to make them convinced that which style of a hearing aid best fit for them. Okay.
Okay.
Generally it is very common that people would be wanting to wear a hearing aid which is more cosmetically appealing.
Right. So which is not seen.
Which is not seen, which is
Right.
hidden, compact.
Correct.
So generally people would come and ask. So okay, we'll discuss what are the different types, and then we'll go into advantages and disadvantages,
Right.
especially with respect to elderly population. So
Alright.
the generally hearing aids in its style, we'll divide it into two. One is it can be worn outside the ear, and
Right.
one is inside the ear.
Okay.
So inside the ear, we have around three types. Okay, one is very small, which goes completely inside the ear canal. So ear canal is the opening in the ear that you see.
Yes, we have a caller now. Hello.
ഹലോ.
ഹലോ നമസ്കാര മാഡം ಹೇಳಿ.
എനിക്ക് ഒരു ചോദ്യം ഉണ്ടായിരുന്നു.
അറിയോ?
ഇത് പ്രായം കൂടുന്തോറും കേൾവി ശക്തി കുറയുമെന്ന് പറയുന്നുണ്ടായിരുന്നല്ലോ. അപ്പൊ അത് എത്രാമത്തെ ഒരു ഏജിലായിരിക്കും അങ്ങനെ ഒരു കേൾവി ശക്തി കുറയണത് തുടങ്ങുക?
സാധാരണഗതിയിൽ ഹിയറിംഗ് ലോസ് സ്റ്റാർട്ട് ചെയ്യുന്നത് ഒരു 50 വയസ്സ് തൊട്ടിട്ടാണ് നമ്മൾ കണ്ടുകൊണ്ടിരിക്കുന്നത്. അതായത് 50 മുതൽ 55 വയസ്സ് വരെ. അതിനുശേഷം ചെറിയ രീതിയിൽ ഹിയറിംഗ് ലോസ് സ്റ്റാർട്ട് ചെയ്യുമെന്ന് പറയാം. അപ്പോൾ തുടക്കം ഒരു ചെറിയതായിട്ട് ഒരു 5% അല്ലെങ്കിൽ 10% ഒക്കെ ഹിയറിംഗ് ലോസ് ഉണ്ടാവുള്ളൂ. അപ്പോൾ അത് മനസ്സിലാവാൻ പറ്റുന്ന ഒരു രീതിയിലായിരിക്കണം എന്നില്ല. ഒരു മിനിമം ഒരു 20-25% വരെ ഹിയറിംഗ് ലോസ് ഡെവലപ്പ് ആവുന്നവരെയും അത് ഹിയറിംഗ് ലോസ് ഉള്ളതായിട്ട് അവർക്ക് അനുഭവപ്പെടണമെന്നില്ല. ഒരു 20%-ഒക്കെ മേലെ വരുമ്പോഴാണ് സാധാരണയായിട്ട് സംസാരിക്കും. ഇപ്പോൾ വീട്ടിൽ ഒരാൾ മറ്റൊരാളായിട്ട് സംസാരിക്കുമ്പോൾ, അല്ലെങ്കിൽ പുറത്തു പോയി മറ്റുള്ളവരായിട്ട് സംസാരിക്കുമ്പോൾ, അല്ലെങ്കിൽ കുറച്ച് ഫ്രണ്ട്സിൻ്റെ കൂടെയൊക്കെ ഇരുന്ന് സംസാരിക്കുമ്പോൾ മനസ്സിലാക്കാൻ ബുദ്ധിമുട്ട് വരിക, അല്ലെങ്കിൽ ടി വിയിൽ കേൾക്കുന്ന സമയത്ത് വോളിയം കുറച്ച് കൂടുതൽ വയ്ക്കണം തോന്നുക, അല്ലെങ്കിൽ ഏതൊരു ഫംഗ്ഷൻ ഹാളിൽ പോകുമ്പോൾ ദൂരെ ഇരുന്ന് കഴിഞ്ഞാൽ കേൾക്കാൻ കഴിയില്ല, അപ്പം ഫ്രണ്ട് സീറ്റിൽ തന്നെ വന്നിരിക്കണം, അങ്ങനെയുള്ളൊരു ഇതൊക്കെ വന്നു തുടങ്ങും. നമ്മൾ എത്ര വയസ്സിലാണെന്ന് ചോദിച്ചാൽ ഏതാണ്ട് ഒരു 50 വയസ്സ് എന്ന് കണക്ക് കൂട്ടും. അപ്പോൾ 50 വയസ്സിന് ശേഷം എല്ലാ വർഷവും നമ്മുടെ വീട്ടിൽ പ്രായമായവരുണ്ടെങ്കിൽ എല്ലാ വർഷവും ഒരു തവണ ഹിയറിംഗ് ചെക്ക് ചെയ്ത് എപ്പോഴാണോ അത് ഒരു ലെവലിൽ കൂടുതൽ പോകുന്നത് ആ സമയത്ത് അതിനനുസരിച്ചുള്ള ട്രീറ്റ്മെൻറ്റുകൾ ചെയ്യുന്നത് നല്ലതായിരിക്കും.
ഇപ്പോ 50 വയസ്സ് കഴിഞ്ഞാൽ അപ്പൊ തന്നെ എന്തായാലും വരണമെന്നും ഇല്ലല്ലോ അല്ലേ? അപ്പൊ അതിനായിട്ട് നമ്മൾ എന്തെങ്കിലും ഇപ്പോ ഹിയറിംഗ് ലോസ് വരാതിരിക്കാൻ ഇന്നത് ചെയ്യാൻ പറ്റും, അങ്ങനെ എന്തെങ്കിലും നമുക്ക് ചെയ്യാനുള്ളതുണ്ടോ? ഇപ്പൊ പ്രിവെന്റീവ് മെഷേഴ്സ് പോലെ എന്തെങ്കിലും ചെയ്യാനുണ്ടോ?
ഇപ്പൊ ഇന്ന് നമ്മൾ പ്രായമായവരിൽ ഉള്ള ഹിയറിംഗ് ലോസ്, അതായത് അവരിൽ കേൾവിക്കുറവ് എങ്ങനെയാണ് വരുന്നതിനെ കുറിച്ചാണ് നമ്മളിന്ന് സംസാരിക്കുന്നത്. അപ്പോൾ ജനറലി പ്രായം മുഖേന ഉണ്ടാകുന്ന ഹിയറിംഗ് ലോസ് നമുക്ക് ഒരു പരിധിക്കപ്പുറം കൺട്രോൾ ചെയ്യാൻ പറ്റില്ല, തടുക്കാൻ പറ്റില്ല. അത് എങ്ങനെയാണെങ്കിലും പ്രായം കൂടുന്നതിനനുസരിച്ചിട്ട് ഹിയറിംഗ് ലോസ് വരും, കേൾവിക്കുറവുണ്ടാവും. പക്ഷെ ആ കേൾവിക്കുറവ് എത്ര അളവ് വരെ വരും, അതിൻ്റെ ഇമ്പാക്റ്റ്, അതിൻ്റെ അവരുടെ നിത്യജീവിതത്തിൽ അതിൻ്റെ ഇമ്പാക്റ്റ് കുറച്ച് കൊണ്ടുവരാൻ വേണ്ടിയിട്ട് നമുക്ക് ചില കാര്യങ്ങൾ ചെയ്യാൻ പറ്റും. അപ്പോൾ അതിൽ പ്രധാനപ്പെട്ട കാര്യങ്ങളാണ് ഒന്ന്, അവരുടെ ഹെൽത്ത് ചെക്കപ്പ് ചെയ്യുക എന്നുള്ളത്. ഇപ്പോൾ ജനറലി വയസ്സാകുന്തോറും സംഭവിക്കുന്നതാണ്, ഒന്നുകിൽ ബ്ലഡ് പ്രഷറിൻ്റെ പ്രശ്നം ഉണ്ടാവും, അല്ലെങ്കിൽ ഡയബറ്റീസിൻ്റെ പ്രശ്നം ഉണ്ടാവും, ബ്ലഡ് ഷുഗറിൻ്റെ പ്രശ്നം ഉണ്ടാവും. അപ്പോൾ ഇങ്ങനെയുള്ള പ്രശ്നങ്ങളൊക്കെ ഉണ്ടെങ്കിൽ അത് നമ്മൾ കണ്ടുപിടിക്കാതിരിക്കുകയാണെങ്കിൽ കുറച്ച് കഴിയുമ്പോഴത്തേക്കും ഈ കേൾവിക്കുറവ് ഒരുപാട് കൂടുതലായിട്ട് വരാനുള്ള സാധ്യതകളുണ്ട്. അപ്പോൾ ഇപ്പോൾ 50 വയസ്സ് കഴിഞ്ഞു കഴിഞ്ഞാൽ നമ്മൾ ഈ കേൾവി കുറവ് കണ്ടുപിടിക്കുക, അതിൻ്റെ ടെസ്റ്റുകളും കാര്യങ്ങളൊക്കെ ചെയ്യുന്ന പോലെ തന്നെ ജനറൽ ഹെൽത്ത് ചെക്കപ്പ് ചെയ്ത് വയ്ക്കുക. ബ്ലഡ് പ്രഷർ, ബ്ലഡ് ഷുഗർ, അങ്ങനത്തെ കാര്യങ്ങളൊക്കെ ചെയ്ത് അത് കൺട്രോളിലാണോ എന്നുള്ളത് ഉറപ്പ് വരുത്തുക. അത് കൺട്രോളിലല്ല എന്നുണ്ടെങ്കിൽ അതിനനുസരിച്ചിട്ടുള്ള മെഡിക്കൽ ട്രീറ്റ്മെൻറ്റ് ഒരു ജനറൽ ഫിസിഷ്യനെ കണ്ട് അതിൻ്റെ ട്രീറ്റ്മെൻറ്റുകൾ നിരന്തരമായിട്ട് അത് നമ്മൾ ചെയ്തുകൊണ്ട് വരണം. രണ്ടാമത്തെ കാര്യം, വലിയ രീതിയിലുള്ള ശബ്ദങ്ങളുള്ള സ്ഥലങ്ങളിൽ പോകാതിരിക്കുക, അല്ലെങ്കിൽ അങ്ങനെ ശബ്ദങ്ങൾ ഉണ്ടെങ്കിൽ അതിന് ഇയർ പ്രൊട്ടക്റ്റീവ് ഡിവൈസസ് എന്ന് പറയും. ചെവിയിൽ സൗണ്ട് പോകാതിരിക്കാൻ വേണ്ടിയിട്ട് ഉപയോഗിക്കുന്ന ചെറിയ ബ്ലോക്ക് ചെയ്യുന്ന പോലത്തെ ഉപകരണങ്ങളുണ്ട്. അപ്പോൾ അങ്ങനെയുള്ള ഇത് ഉപയോഗിക്കുക. പ്രത്യേകിച്ച് സംഭവിക്കുന്ന ഭയങ്കര ഒച്ചത്തിൽ മ്യൂസിക് കേൾക്കുക, അല്ലെങ്കിൽ ഫോൺ ഒരു 70% മേലെ ഫോണിൻ്റെ വോളിയത്തിൽ തുടർച്ചയായിട്ട് ഫോൺ കേട്ടുകൊണ്ടിരിക്കുക, അല്ലെങ്കിൽ ലാപ്ടോപ്പിലോ അല്ലെങ്കിൽ ടി വിയിലൊക്കെ ഹെഡ്ഫോൺ വെച്ച് വളരെ ഉയർന്ന ഒച്ചത്തിൽ അത് കേട്ടുകൊണ്ടിരിക്കുക. ഇങ്ങനെയൊക്കെ ചെയ്യുമ്പോൾ ആ ഒരു ബുദ്ധിമുട്ടുകൾ ഉണ്ടായിക്കൊണ്ടിരിക്കുക. അതിനെ നമുക്ക് കൺട്രോൾ ചെയ്യാൻ പറ്റും.
Okay, doctor. Thank you.
Okay. So I presume the caller was asking about the prevention of hearing loss in
Exactly.
elderly, right?
Yeah.
So you were telling about how to limit the exposure to noise, loud noise, and manage the health conditions, and also to monitor the hearing capacity over a period of time. Right?
Annual follow-up.
Yes,
So
yes.
Every year they can go for
Yes.
an annual follow-up and take a decision depending upon how is their hearing capacity, which changes over the period of years.
Yes, so that was a very good take-home message wherein we want all the elders to get their hearing tested every year.
Every
So
year.
what is the age do you recommend generally?
Maybe we can say 55.
So above 55 years, so attention all the elders, above 55 years you have to get your hearing tested annually so that you can monitor the progress of hearing loss, right? Yes, so we'll come back to our discussion wherein we were discussing about different styles of hearing aids, right?
Exactly.
Yes.
So one is inside the ear canal, which is called CIC, which is completely inside. Or second one is ITC, in the canal. So which is just behind the, it will be visible
Inside.
just outside the opening of the ear canal.
Okay.
And then ITE, in the ear, which is almost filling up the canal area, okay, which is
Right.
called a concha, the cavity kind of a thing that you see from outside, which will be filled up. So these are the three different kind. And nowadays you have IAC, which is completely inside, which is not even visible from outside. Okay.
Correct.
And the other two designs which are there outside the ear canal, which is called BT, behind the ear, and RIC, receiver in the canal. Then BT is a bigger hearing aid which fits snugly above the ear canal. And RIC is a compact one which is a smaller in size with a thin wire which is going inside the ear canal. Now, when we consider an elderly, the primary factor that we consider is their manual dexterity. Okay. More than the cosmetic appealing, what we would prefer is they're easy to handle those hearing aid, and generally their cognitive abilities are, especially even those with hearing loss, there are a lot of literature saying that those who have hearing loss, the dementia, memory loss, all that would be there in them. So they might not remember everything that easy.
Okay, right.
So when you give a hearing aid which is slightly bigger in size, so that they can operate it very easily, about opening the battery compartment, placing the battery and taking it out, and controlling the volume, and then fitting the hearing aid and taking it, all that will become very easy for them if it is slightly bigger in size. If they are able to manage, okay, with if their manual dexterity is very good, and even if it is a thin wire, they are able to remove it and insert it snugly without putting more of a force. And if their hearing loss is within that limit, okay, if it's a smaller hearing aid, then it will not give much of a power. It can only give a limited power. So if their hearing loss is within that power, and their ear canal is not shrunken, and they are able to manage all these smaller changes that they can make.
Correct, okay.
In those cases, they might be able to undergo for a smaller hearing. But generally, we do not recommend. We would recommend, if elderly, to use a hearing aid which is behind the ear.
Okay. So basically, the style of the hearing aid not only depends upon the type and degree of hearing loss, but it also depends upon the other factors, the way you handle, is your hand shivering,
Yes.
in order to put the batteries inside the hearing aid will also matter, right? Okay. So we'll come to the end of the session. So we want to know how our organization, so All India Institute of Speech and Hearing, can help the elderly individual in availing hearing aids or any such facilities.
See, basically, as you heard from all of us telling, that hearing aid is the major chunk of treatment in elderly population.
Correct.
But we never discussed what is the cost of that hearing aid basically. So to understand that, the basic digital hearing aid cost, if you are purchasing outside in any of the private clinic, it would start from around 15 to 20,000 rupees minimum. So that is MRP or the selling price outside. But being the premier institute in this area, and because it is a central government funded institution, we have a scheme called HADU, where we are providing hearing aids at a discounted price of about 50 to 60% from outside. So from MRP, we would have about 40 to 50%. So whatever 20,000 or 25,000 hearing aid outside, probably you will get within 12 to 15,000 in Aish.
Okay.
So that is the major scheme that we are running. But however, there is some amount of waiting period, testing time delay. So those things will be there because of the huge number of patients who would visit us. So on appointment basis, probably the things can get a little smoother. Second thing is, whoever is already employed or retired employees who is central government or state government, they can get some amount of reimbursement from state government and central government. Okay. So whoever gets certificate from our institute that it's the proper treatment and they have procured hearing aid from this thing, so claim amount would be little better for such people, and claiming is much easier for such schemes. Then something called as ESI is a very vastly used insurance now, because all the private firms has this ESI facility for their employees. So that scheme is also done through us, a major chunk of it from our end. So that's an easy way to get the hearing aid. Or we have something called as client welfare fund for BPL card holders, where we give additional 40% of discount on the hearing aid, so that for lesser price they can get hearing aid. And majorly now government is coming up with so many schemes like PM fund or CM fund, where they can avail this hearing aid as a treatment option, where they will provide 50 to 60% of the funding from that, and other 40% patient can avail. So that is an option. So for such schemes also, they are asking certification and a letter from our institution to claim that amount. So in all this way, for a person who is finding it difficult to avail or get that funding for hearing aids, it will be easy run through with our treatment and our evaluation procedures for them to get such funds. So that's the way where if somebody wants to have some kind of a funding this thing, we are there to help. Obviously, if the person is ready to fund for self-fund and get a hearing aid also, they are getting it at a cheaper rate from outside.
Okay. Okay. So we are at the end of the session. To sum up all our discussion so far, okay, so we want all the young individuals to encourage your elderly family member to get their hearing tested. Okay, so once a hearing aid is being prescribed from a hearing aid professional, so we would always advise you to wear the hearing aid so that it will not affect your emotional well-being and the social well-being. With this, we come to the end of the session, and I would like to extend my thanks to the resource persons, okay, on behalf of director and everybody. So until next time, if you want more such videos, you can subscribe our YouTube channel and stay tuned to our Facebook page. Thank you.